right, so now you're ready to think about how can we tell if someone is using MI Spirit. Well, how we tell is that we have to be able to assess it. So we're going to give you a framework for assessing it. This framework was developed with funding from the federal government, so it's freely available. And these items I'm showing you are from MIA-STEP, S-T-E-P, which are supervisory tools to enhance proficiency. So if you want to look that up, you can get the full scale. It's all online. Okay, so before we get started, I just want to also say what can get in the way of MI Spirit one more time. And that's this thing called the writing reflex. And it comes from a place of all of our training. We know that everyone should get, with rare exceptions, everyone should get the coronavirus vaccine. We know that people shouldn't share needles when they use intravenous drugs. We know a lot of things. So we are wanting to impart our knowledge. We're going to make things right, make the world right. We want to set these people on the right path so that they can live and be healthier and do our jobs. So that's called the writing reflex, and we have to let go of it, or at least acknowledge that it's there and fight it as a reflex, because that is not the most effective way to write the world, is to go by our writing reflex. And the reason is this thing called reactance. Reactance means that people become very upset when they perceive their freedom is being threatened or eliminated. And that is especially true of Americans, right? We were all coming here to be free. And so this country selected for the people with the highest levels of reactance. And so it's in our collective American genetics. And so when Americans especially perceive that their freedom is being threatened, they're going to attempt to reassert their lost freedom, and we're going to end up not having a productive interaction. So we have to understand that humans are motivated to possess and preserve as many options and choices as possible. And when people's options are threatened, they experience an aversive emotional state, which is called reactance. And it's exactly the opposite of how you want someone to feel when they're interacting with you. You don't want to be aversive. You want to be, hey, that was fun to talk to that person. So that's the writing reflex. And when you've seen ineffective consultations, you've seen the writing reflex in action. Okay, so here we go. Here's how we assess MI Spirit. We have a nice definition. To what extent did you provide low-key feedback, roll with resistance, use a supportive, warm, non-judgmental, collaborative approach? To what extent did you convey empathetic sensitivity through words and tone of voice, demonstrate genuine concern and awareness of the client's experience? To what extent did you follow the client's lead in discussions instead of structuring the discussions according to your agenda? Or obvious, so the word obvious could also be in there, because you can structure it, but your structure could be not obvious to the person. That would be a guiding style. So in order to answer these three questions, you have to have tapes, audio tapes. You could also have videotapes, but bare minimum audio tapes or transcripts of the clinician-client interactions, because you should be able to pull from the transcripts examples of all these three things. So we have to get our staff and ourselves used to the idea that we're going to tape ourselves. And hey, no one wants to see themselves on tape. And you're going to get a lot of resistance there. But there's no other way to do this, is to watch yourself, see what you might do differently next time, and just get better and better at it. If you don't watch yourself, you don't engage in reflective practice, you don't try to assess yourself, you will not become proficient in this technique. Okay, so then we have our writing reflex and our MI inconsistent behavior. So you notice that we only really, well, you'll see some more, but we have one main item to rate MI spirit, and then we have several items here that rate the opposite. So item 11 on our form, where you're going to see the other items on this form later on. We do this one first, so they're kind of out of order. So item 11 is unsolicited advice, direction giving, and or feedback. To what extent did you give unsolicited advice, direction, or feedback, offering specific concrete suggestions for what the client should do? To what extent was your style of one of instructing the client how to be successful in his or her recovery? So that gets you a big negatory on your MI score. In fact, if you even have a 2 on this, you fail. There should be 0 of this in a good MI. So you say, well, how can I give information if I do 0 of this? The answer is the word unsolicited. Hey, is it okay if I share with you what some other people have done that have had this problem? Hey, is it okay if I share with you some research on the prevalence of HIV positivity in the intravenous drug users in Bridgeport? Then you can decide about your needles, right? So you're going to ask permission, and that is going to put the control in the client's hands, not yours. Direct confrontation. So this used to be in the 70s. I'm old enough to have seen the tail end of this barely. It was still prevalent in the 80s as well. That's 1980s. Confrontation. To what extent did you directly confront the client about his or her failure to acknowledge problems or concerns related to substance use or behavioral difficulties? To what extent did you directly confront the client about not taking steps to try to change identified problem areas? This comes from the belief in the stick that we talked about a couple weeks ago. So again, a 2 is an F. It needs to be 1, which is really 0. You could, there should be a 0 here, but anyway, it's a 1. Asserting authority. So again, this is a physician thing, especially. To what extent did you verbalize clear conclusions or decisions about what course of counseling would be best for the client, or what course of behavior change? How much did you warn the client that recovery would be impeded unless they followed your suggestions? To what extent did you tell the client what works best in treatment, or the likelihood of poor outcome if they tried to do his or her own treatment? To what extent did you refer to your own experience, knowledge, and expertise to highlight the points you made? Hey, I got the coronavirus vaccine. Why can't you do it? Okay, that's asserting authority. So, again, 1/0. 2's an F. Okay, so now look on Canvas for the rating scale. And the next video in the sequence is going to be this one. And look at how beautifully Rolnick shows you what MI Spirit is. It's really, you know, if you understand this procedure, it just should bring tears to your eyes because he just does it so masterfully. So I'll see you after you've seen this video.